Refractive lens exchange is a procedure to help people see better without their glasses or contact lenses. When most people think about getting less dependent on their glasses or contact lenses, they think about things like laser vision correction or LASIK. LASIK works on the glassy front part of the eye with a laser. With refractive lens exchange, we do things a little bit differently. Inside the eye, there's a lens, and that lens is exchanged for a man-made or synthetic lens when we do refractive lens exchange. When we do this, we have the ability to place a synthetic lens that has special properties to it. The properties we can fix are nearsightedness, astigmatism, farsightedness, and even bifocals. We're fortunate that at Eye Surgeons of Indiana LASIK Center, we're able to use a variety of techniques and pick the individual technique that works best for any specific patient. Good candidates for refractive lens exchange include those patients that are over the age of 40 who wear bifocals or contact lenses frequently. A lot of people have a lot of interest in hobbies that just don't get along well with glasses and contact lenses. We're able to free patients from a lot of these encumbrances and allow them to enjoy life a little bit better. On the day of the procedure for refractive lens exchange, there's no discomfort. The anesthesia works very, very well. There are no needles or stitches or patches around the eye. The recovery with refractive lens exchange is pretty rapid. Generally, the next day, patients see well, and sometimes even that very same day that the procedure is done, people comment that their vision has improved markedly.